Did you know that looking at your teeth could determine your overall health? You see, having healthy teeth is more than just having them look really white. But if you have unhealthy teeth, it's been linked to a ton of different diseases like heart disease, Alzheimer's, diabetes, even bone loss. But in this video, I'm gonna go over some of the signs that your mouth are giving you and what you can do about it, so stick around. So the first thing I wanna talk about is Alzheimer's. So some recent studies have found that the same bacteria that is found in people that have gum disease is also found in the brains of people that have Alzheimer's. This bacteria is called P. gingivalis. Now, when you have gum disease, it means you have a lot of these bad bacteria in your mouth. And it means that your gums are really inflamed. So when these bad bacteria start building up, they start getting underneath your gums. And since your gums are really inflamed, they'll start to bleed because there's so much inflammation going on. And what happens is these bacteria can get into your bloodstream. They can start entering your blood, and from there they can make their way to your brain. Now you don't just have this inflammation in your mouth, it's actually a chronic inflammation, an inflammation in your whole body. And this inflammation can make its way to your brain along with this bacteria. And the thought is that this can lead to that neurodegeneration where you're starting to damage these nerve cells and lead to a condition like Alzheimer's. Now, does that mean that everybody that has gum disease is gonna get Alzheimer's? No, but I did make a video kind of going into more detail if you want to learn more about it. So make sure you check the description below if you want to find that video. But in a nutshell, some key signs you want to look out for that signal you have gum disease are that you have bleeding gums, or your gums look a little puffy or a little more red or a little swollen. These are all really bad signs because your gums should be kind of tight to your teeth. They shouldn't be loose around your teeth, and they should definitely not bleed at all. So if this sounds like you, it's definitely time to make that dental appointment, get everything checked out, make sure everything's okay, but also improve your oral hygiene at home. That includes brushing and flossing. Now the next thing I want to talk about is your heart. Kind of like we talked about before, when you have gum disease, these bacteria can get into your bloodstream. And from there, they can cause systemic problems. We talked about how they can affect your brain, but they can also affect your heart. Gum disease is linked with the higher risk of heart attacks, strokes, and clogged arteries because these bacteria can actually get into these arteries and cause these plaques to form and kind of constrict those arteries. You simply cannot have a healthy body if you do not have a healthy mouth. So again, you want to look out for the same symptoms I talked about before. So if you have those swollen gums, the gums that are bleeding, if you have this bad breath, then these are all really bad signs. So definitely get them checked out. The third systemic problem you can get is diabetes. Diabetes is also linked with gum disease. When you have gum disease, when you have these bacteria that are entering your bloodstream, you have this chronic inflammation. What happens when you have chronic inflammation is your blood sugars rise. How can you fight diabetes if your blood sugars are that much higher just naturally? Because you have this artificially high blood sugar, this gum disease makes it harder to manage your blood sugar levels in the first place, which is what diabetics struggle with all the time. Now, if your diabetes is not well managed, then this can lead to a whole list of other problems, not just with the rest of your body, but also your mouth. It can lead to dry mouth, it can lead to more infections, it can lead to tooth loss, and if you ever need any sort of surgery or anything like that, you're gonna have a lot harder time recovering from that surgery. So if you have a chronically dry mouth, or if you notice that you have really slow healing compared to the average person, or if you notice you get a lot of frequent cavities or you get these dental abscesses, it could be more than just your teeth that are the problem. It could also be the diabetes. Now again, just like I said before, just because you have gum disease or cavities or infections in your mouth doesn't mean you're gonna have diabetes. But if there's a big relation here, you don't want to take the risk. Many patients actually find out that they are diabetic from their dental visit. That's how connected your mouth and the rest of your body are. Now the fourth thing I want to talk about are respiratory infections. Just like how your bacteria in your mouth can enter your bloodstream, it can also travel into your lungs. Bacteria from gum disease is linked to pneumonia and chronic bronchitis, especially in older adults. So some warning signs of this are if you have coughing fits in the morning, like every morning you wake up and you have to cough a lot, or if you have a lot of this postnasal drip, like you get a lot of mucus that drains, or if you just have this persistent bad breath that just doesn't go away. Now for a lot of these symptoms, there could be a ton of other reasons behind it. Like you could just have a ton of sinus infections and that could lead to the postnasal drip, or you could just be eating a bunch of nasty foods that cause a bad breath, but it's not something you want to ignore. And the thing is, fixing the problem, if it is actually from your mouth, is actually so easy. You just gotta make that visit to your dentist and make sure you do your due diligence at home. Now the fifth thing I wanna talk about is bone loss. This one kind of goes both ways. So if you have, for example, osteoporosis, it can weaken the bones in your body and even weaken the bones in your jaw. So for example, if you need to get a dental surgery and we see that your bone is really weak, this can make it really difficult because your osteoporosis has weakened that bone. For example, before I do dental implants, I have to take a 3D x-ray. This is called a CBCT. And during the CBCT, I can kind of evaluate how that bone is. And if that bone is more dense, then it seems like it's going to be an easier time placing that implant. But if that bone is really soft, it can be a lot harder. Now, if that bone is extremely soft, this could be a sign of that osteoporosis. Now, it also goes the other way around. If you have gum disease, then this can also weaken the bone in your jaw. Because if this gum disease gets so bad, these bacteria not only spread to the rest of your body, they also cause a ton of inflammation in the mouth. And this inflammation can lead to bone loss. The support structures that support your teeth can start to deteriorate and get weaker. And over time, your teeth can get more loose because your bone is literally being pulled away from your teeth. So if you have loose teeth, or you feel like your teeth are shifting, or even if you feel like your gums are receding, because when your bone recedes, then your gums will also follow it. These are all bad signs as well. Now, the sixth thing I want to talk about is rheumatoid arthritis. Gum disease and rheumatoid arthritis share pretty similar inflammatory pathways. And studies even show that when you improve the gum disease, you actually end up improving the arthritis symptoms. So the key signs to look out for are the same ones I mentioned before. Unhealthy gums are going to be more swollen, they're going to be pink, they're going to be more red, they're going to bleed a lot more. So healthy gums are more pinkish. Now the actual color really depends on your race, but in general they're going to be more on the pink side, they're going to be tighter and more firm around your teeth, and they're not going to bleed. The bottom line is your teeth and your gums are connected with the rest of your body. And if you have something going on with your mouth, it can spread to the rest of your body as well. So make sure you take care of your teeth. And as always, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. You're trying to whiten your teeth, but what if the methods that you're using are actually making them worse? There's things like charcoal toothpaste or different baking soda and lemon juice hacks. Well, it turns out that some of these whitening tricks could actually be making your teeth worse. And not only that, making your teeth more yellow. So in this video, I'm gonna break down some